Access to affordable and sustainable water, sanitation and hygiene is still a big challenge to many communities. This has negative impacts on the livelihood, well-being and health of many people across the world. According to a joint program by UNICEF and WHO, it has been established that more than 844 million people do not have access to basic drinking water. A further 2.3 billion people lack access to basic sanitation and hygiene services. In line with UN's SDG 6, which aims at ensuring availability of water and sanitation for all, humanitarianglobal.com has collaborated with world's best WASH experts to prepare an introductory course in WASH to empower more people in steering this goal. Undertaking a certificate in WASH program gives you an in-depth knowledge and understanding of Introduction to WASH. In the first module, the learner will get to understand the fundamental principles and approaches in WASH, global availability of fresh water, right to water and sanitation and the post-2015 WASH development agenda. Secondly, sanitation and hygiene. This module allows you to learn about sustainable sanitation, sanitation in schools, hygiene improvement and disease transmission routes. And thirdly, cross-cutting issues in WASH. In this last module, the learner will get to study some of the cross-cutting issues in WASH such as participation, gender, environment and inclusion of the most vulnerable community members. To register, please visit our website www.humanitarianglobal.com for more details.
Rose, thank you for sharing. I can see it well.
Okay.
Ladies and gentlemen, I think we can begin our session today. Once again, I'd like to introduce myself. I am Eric, I'm part of the Humanitarian Global team that has brought you this session today. We have a WASH session. And to begin with, I'd like to invite Anthony to give us a small introduction before we move on to the next step. Anthony, I don't know if you can hear me.
Yes, I can hear you, Eric. And thank you so much, Eric, and to all of our participants for joining today. And I can see that we're very much on time. And thank you so much once again. So my name is Anthony Mukhi, the Academic Registrar at Humanitarian Global, organizing for this particular event, where we want to look at gender equality, disability, and social inclusion. And with us, we have Rose, who will be taking us through. But before that, it might be your first time interacting with us and joining the session. So Humanitarian Global, we are an organization that does focus on capacity building and training, offering training across different thematic areas. One of them is water sanitation and hygiene. We do also monitoring, evaluation, accountability and learning, food security and nutrition in emergencies, human nutrition and dietetics. We also do maternal, infant and young child nutrition. We also do procurement and supply chain management alongside very many other areas. So as we look forward to a very interactive session, and I can see our facilitator, she's very much ready to take us through in case you have an inquiry about our programs, because we also do offer programs in the same field, as I mentioned, and we will be sending them on the chat section so that you can have a look at them. In case you have an inquiry, feel free to interact with us. And with that said, I would like now to invite you back, Eric. I think we'll be interacting again as the session is in progress as we take some breaks.
Thank you, Anthony, for that introduction. And this time I'd like to invite Rose to begin the next step. And just before Rose begins, just to remind our participants, for any question that you have regarding today's session, kindly post it on the Q&A. For any question, kindly use the Q&A to post it, and our team is going to get back to you. That will be a question on today's session, the webinar, or any other question on Humanitarian Global. We are here to serve you. Rose?
Thank you so much, Eric. I hope I'm audible enough.
Yes, you are.
Thank you so much, and welcome everyone to our session this morning, wherever you are logged in from. Today we'll be doing just a short overview, just in terms of understanding gender equality, disability, and social inclusion in the context of WASH. And I would like to welcome all of you. If you have any questions, please type in the Q&A, and we'll endeavor to answer them after the session. Welcome everyone. Welcome everyone. Okay, so today we'll do more of it's really an overview, because if you look at gender on disability and social inclusion, it's quite a broad topic, but I've tried try as much as possible just for us to look in terms of within the context of WASH. So the lens that we are looking at GEDSI today is just in the lens of WASH, because it's an area that can be applied in the various fields. But for us today, we'll just be focusing on WASH. So we'll do a brief introduction, and then we'll look at several different groups that we think are part of this gender equality and social inclusion. And then we will look at in terms of the key definitions for our topic today, which will be gender and disability. And then we'll also look at some key concepts that are used. So we'll look at the concept of equality. We'll also look at the concept of equity. We'll also look at the concept of non-discrimination. We'll look at the concept of inclusion and also the concept of exclusion. And then now we will delve more into gender and WASH. And then we will also look at disability and WASH. We'll also look at age and WASH. We'll look at health status and WASH. And then we'll look at something called barrier analysis, how to conduct a barrier analysis. And then we'll look at inclusive WASH, what it really entails. And then we'll look at some of the examples, some of the accessible WASH technologies. We may not do a comprehensive, really, I will not do so much comprehensive in all these topics for today, but I will touch at least, I will do a touch in each of them so that at least we have a broad understanding. So welcome, and let's hope this session will be good. Okay, so let's begin first looking at access to WASH. Oftentimes we've been looking at access to WASH, looking from a needs perspective, but for our perspective today, we'll be looking at it from a rights perspective, and I'll be able to explain later much about the rights perspective to WASH. So today we'll be focusing much as in terms of WASH from a rights perspective. So we know that access to drinking water and sanitation and also to hygiene is a basic human right, and it is essential for achieving gender equality, sustainable development, and poverty alleviation. So the key thing for us today is about looking at it from a human rights perspective, that it is a basic human right. So the right to water and sanitation, what it requires is that if we are talking about it in terms of it being a human right, is that it has to be available, it has to be accessible, it has to be safe, it has to be acceptable and affordable for all without discrimination. The key word here is without discrimination. So when we talk about without discrimination, means that it has to be available, accessible to all. So despite any status of an individual, wherever they are, where they are living, their state of health, so it doesn't matter. So it has to be, services have to be available to all. So if you look at the SDG 6, SDG 6 talks about availability and sustainable management of water and sanitation for all. So for all means it's for everyone. So inclusive every individual, despite maybe a social status of an individual, maybe where they're born. So it doesn't matter. So it looks at everyone. So even achieving the SDG 6, it's all about ensuring that it is all people, all individuals are able to achieve and also be able to have availability of these services. So from this perspective, you see that today we are looking at WASH from a rights perspective. So in that it has to be like everyone should really be able to access it. There should be no discrimination. And for us to achieve SDG 6, it's all about ensuring that it is available for all. Let's look at the Human Rights Council of the UNGA. They talk about the right to water, the human right to water entitles everyone without discrimination to safe, acceptable, and physically accessible and affordable water for personal and domestic use. So the human right to sanitation also, it entitles that everyone without discrimination to physical and affordable access to sanitation in all spheres of life. So if you look at it from the Human Rights Council, it's also talking about without discrimination, meaning that it's all people, every individual should have access to safe and sufficient and acceptable water services. And also in terms of sanitation, it has to be without discrimination. But in the context that we work in or where we live in, you would still find that many people in many communities still do not enjoy these rights. The rights that we have talked about, that people, each and every individual has a right to water, it has a right to sanitation, has a right to safe hygiene, but you still find that many people within the communities that we are living in or the communities that we are working in actually do not enjoy these rights. What it means is that they're still excluded for a number of reasons, and they are still struggling to cope without access to basic water and sanitation and hygiene. Just pause for a moment and think about where you live or where you were born, and also think about the communities that we are working in. You would find that this statement here really still makes sense, in that there's still many people within the communities that we are working that do not enjoy these rights to water and sanitation and hygiene. There are many who are still excluded for many reasons, which we will look at in the next slides. So they're still struggling to cope with the access to basic water and sanitation. So let's have a look briefly about who are these groups that we think, that we say that they are likely to be excluded from maybe getting the services. There are a number of groups really, but these are just examples of groups that are at risk of exclusion. So there are these are just a few that I've identified, but I know there's still more, but these are some that we can identify with, and these are the ones that we can also talk about later when we're talking about accessible or inclusive WASH. So we have groups like women and girls that are usually are likely to be excluded in terms of water, sanitation, and hygiene. We have people with little or no education. We have older persons. We have persons who are populations that are displaced. We have people with disabilities. We have people living with HIV and AIDS. We have ethnic minorities. So we have also people or populations that live in very, very remote areas, and we also have child-headed households. So these groups, we will be able to look at them. We may not exhaust all the groups, but we will look at them on how we think these groups are likely to be excluded in our water, sanitation, and hygiene services, or even within our programs. So I will look at it in terms of why do we think that women and girls are likely to be excluded? Why do we think sometimes that people with little or no education are likely to be excluded? Sometimes also people who are older persons sometimes are also likely to be excluded. The displaced, people with disabilities, and people with living with HIV and AIDS. So these are just examples of groups that we are likely sometimes to be excluded, not only in WASH, but even generally in the development world. So as I said before, just pause and think. Even where you are working, sometimes we think that communities are homogeneous, like in a community or a village that we work in or where we live in, we usually assume that it's a homogeneous group because maybe they share the same culture, for example, or maybe because they get water from the same source. We believe that sometimes that these are just homogeneous groups. But if you look at it critically, you realize that there are groups sometimes that have different needs, and maybe they need to be considered. So in every community, you would find that we have women and girls. We have people sometimes who have no education. So sometimes we have people who do not have voices, for example, even in meetings. So those are some of what we talk about. They are likely to be excluded. So let's go a bit and define some of the groups here that we're talking about for us to get an understanding. What do we really mean by, for example, disability? So let's just begin with this group, or people with disabilities. What is the definition of people with disability? So I took this definition from the Convention on the Rights of Persons with Disabilities, how they define disability. So the definition that they give, the Convention on the Rights of Persons with Disabilities, is that persons with disabilities include those who have long-term physical, mental, intellectual, and sensory impairments, which in interaction with their different barriers may hinder their full and effective participation in society on an equal basis. Please just underline the term So when we talk about persons with disabilities, from a medical point of view, they have impairments. So they have what we call impairments, but they get a disability when the impairment interact with the barrier. And the barriers is what we'll talk about it later. What are these barriers? So persons with disabilities, so they have physical, mental, intellectual, or sensory impairments. So when the impairments interact with the barrier, that's what really hinders them from the full participation in any society. So an impairment is a physical, sensory, intellectual, or a mental health issue that a person has been born with, or maybe sometimes they acquire through an injury, an accident, or another cause. That's what we call now. So when someone has a physical impairment or they have sensory, maybe they're not able to hear, or sometimes maybe they're not able to see, so that's an impairment. But a disability, it's a result of something. So disability results from the interaction between the impairment and the barrier. So the barriers that we'll talk about later, we have the barriers that we call environmental barriers, we have social barriers, and we have institutional barriers. So when an impairment interacts with a barrier, that's when now we get what we call a disability. I hope this is clear. And then for what I have said, so we'll talk about the barriers later. So I'll be able to expound on what we call barriers, the three categories of barriers. We have environmental, we have social, and we have institutional barriers. So in terms of disability, it's usually an interaction between an impairment and a barrier. That's when now we talk about a disability. So the types of impairments, as I talked before, which are recognized by CRBT. So we talk about physical. So physical is in terms of performance of body functions. So physical may be about walking, moving arms and legs, or using hands, or maybe sometimes as a result of maybe spinal cord injury or cerebral palsy, or maybe because of amputation. Those ones now are categorized as physical impairments. Then we have what we call sensory. So sensory is about hearing or communicating. So maybe it's examples are people who are deaf, or who have hard on hearing, or who are blind, or who have very low vision. Those are the ones we talk about who have sensory impairments. There are those who have what we call psychosocial impairments. So these ones are chronic, severe mental disorders, maybe like schizophrenia or depression or bipolar. So these ones, the impairments are psychosocial. We also have intellectual impairments. So these are categorized like maybe language, reasoning, and memory, and also those who are not able to do what we call personal care. So these are individuals sometimes who have Down syndrome or cognitive impairments or brain injuries. So this is what I talked about before here, that impairment. So there are many types of impairments. So this is what we are unpacking here, that their impairments are also in different categories. So we have physical, we have sensory, we have psychosocial, and we have intellectual impairments. So in terms of the burden, so according to the World Report on Disability, so the estimate is that it's around there are more than 1 billion people over the age of 15 that are living with disability. So in terms of the world's population, so it's about 15.3% of the world population that are considered have a disability. So in terms of gender, so let's define gender. So gender, it's a concept. So gender is not about being born a male or a female. So it's not looking at the biological concept of maybe you're a male or a female, but gender is a concept that refers to socially constructed roles. So it's usually the society, really is coming from a societal point of view. And WHO defines it as socially constructed roles, behaviors, activities, and attributes that particular society considers appropriate, and it ascribes to men and women. So as I said before, it's not about being born as a male or a female, but more of a gender construct really within a society. So it encompasses all the societal attributes we assign to being a female or a male. So this one really differs in different cultures and also in different societies. So these are gender roles. They are socially constructed and they come with a set of expectations and norms. So it usually sets expectations for women, it sets expectations for men, and also with norms. So the gendered identity of women and men, it affects how they are being treated, what their expectations are and how they behave and how they might be expected to think. So for example, sometimes we find, even in meetings, let me just give an example, you find that women sometimes in some societies, maybe they're not even allowed to voice, or they're not supposed to talk when men are talking. So those are just gendered, socially constructed expectations, really, from a society's point of view. So these relations really between men and women, this is what is giving a rise to what we call gender inequalities, where one group is maybe is favored and holds advantage over another. So these are just, it comes with power relations, even in households, really. And so it gives rise to what we call gender inequalities. So you find that maybe one group is usually favored and one group holds advantage over another. So the inequality that we see in position of men and women, it works against progress, really. For society to progress, the inequalities that arise between men and women, it's really what is really causing the progress, slowing the progress of any society. So gender is really a very broad topic, and usually it brings so many discussions, but our focus today, we will look at it more in terms of how we ensure gender in terms of programming. So as I said before, let's look at, before we go into, we'll look a bit about what some of the key concepts. And the first concept I want us to discuss and understand is about what we call equality. So let's say, for example, we have these three individuals here who have gone to watch a football match. So each of them has been provided with a set of tools. So each of them maybe has been given, let's say, a tool for them to be able to view the football match. But despite having the same tools, you find that not everyone is able to see the action. So all these three individuals here have been given this as tool to be able to be able to view the football match that's happening. So we have given them a set of a tool to be able to step on it, to be able to view. But you'll find that not everyone is able to see the action. So you'll find, because this guy is tall, is able to see the action very well. And you see that this second person is likely to also have a view. But this third individual here, even though they've been given this tool, is not able to view the football match. So what this means is that treating everyone the same will not necessarily result in everyone achieving the same outcomes. Because here we are saying that we have treated everyone equal here. Everyone has been given a tool to step on to be able to see the football match. But actually, treating everyone with the same tools is not really solving the issue here. So we are not achieving an outcome here. Not everyone is able here to be able to see the football match. So it's not about giving people the same tools. So equality is not about providing the same type of service to everyone. So we are saying here, like we are in this picture, we are talking about equality. We are saying that we have given everyone a tool to be able to view this football match. But you find that not everyone, even though we have provided them with tools, are able to see the football match. So this is just an analogy to understand what we talk about equality. So let's talk about equity. So this is the same picture, but now in order to actually, for them, the three of them, to be able to have a full view of the football match, we had to put a bit of some practical measures had to be put in place for this equality to be achieved. So for what to be achieved, you find that the first individual who had a stool, because he's already tall, is able to even have a view without. So you'd find that the third individual here, who was not able to, has been provided with a practical measure. He has been given an extra stool to be able to have a view. So with this equity, it means that people, the three individuals now, are able to enjoy the football match. So what this one tells us is that these measures are what we focus on when we talk about equity. So equity is about what we have to do to enable different people to share the same in the outcomes. So the three individuals now, after making changes, you see now they are able to enjoy the outcome. So equity is all about providing tools or mechanisms through which equality can be achieved. So equality is achieved more when we are able to provide tools or mechanisms to different individuals to be able to have the same view. In terms of, let me also give you an example. So sometimes within a country, you would find that when they share resources, you would find that its resources are shared equally, let's say maybe among different regions. So they are given maybe like 20%, but you'd find that there are regions that are usually maybe disadvantaged. So you'd find governments sometimes give them what we call an equalization fund. So this fund is what is able to make them now enjoy equality more. This is what we call equity. It makes it more fair. So I believe we've now been able to understand what we mean by equality and what we mean by equity. So when we talk about equality, oftentimes when we talk about equality in terms of gender, usually the first thing that comes to people's minds is really like it's a women's issue, but actually it's not a women's issue. It's about it's a human issue. So equality is about all people really need to enjoy equal status and respect, rights, responsibilities, and opportunities. So the interests, needs, and priorities of all people are considered, recognizing diversity. So equality is both a human right and also it's a key to development. So it doesn't mean that we want everyone to be the same, but we are saying that we need to give people equal opportunities. So to achieve equality, as I said before, different groups of people may require different treatment, as different groups of people have different situations according to privilege and disadvantage. So equity, as I talked about before, if you are able, for us to achieve equality, we have to bring in the concept of equity. So while equality is an outcome, equity refers to the process to achieve this outcome, which may require different approaches for different groups to respond to different needs, interests, capacities, and socioeconomic status and circumstance. So if you use the same example here, what we talked about here, equity, this is now how you understand it. When we talk about for us to achieve equality, we have to make sure that different approaches, you apply different approaches to different groups so that we may be able to respond to the different needs and interests and the socioeconomic status and circumstances. Let's look at the third concept. So the third concept is about non-discrimination. So you remember when we did the introduction, we talked about the basic right to human to safe water, to access to safe water, sanitation, and hygiene. It should not be discriminatory, so it has to be accessible to all. So the concept of non-discrimination, it is a legal principle that prohibits any distinction, exclusion, or restriction that results in either individuals or groups of people not being able to enjoy or realize their human rights on equal basis. So this from this image, you can see that this is a form of discrimination, really. So we're having within even communities that there are certain groups that are maybe discriminated against. But the concept of non-discrimination, it means that it prohibits any distinction or any exclusion of any groups or people or even an individual for them not being able to enjoy the rights. So the rights can be, for us today, we are looking at the rights to access to water, sanitation, and hygiene. The next principle and the concept we want to look at is in terms of inclusion. Now that we have talked about equity, we have talked about equality, we have talked about different groups that are likely to be excluded, and we have talked about non-discrimination. So what about inclusion? So if you look at the concept of inclusion, if you've read through the 2030 agenda, so it is part and it's a core part of it. So if you look at the SDGs, it has the concept of ensuring that no one is left behind. So the concept of leaving no one behind means that it has to be, any service has to be available and accessible to all individuals without discrimination. But it also looks at, it also knows that everyone and people have different characteristics, and what we talked about, that people are not the same, people are not homogeneous, even within a community or even within a household, that people have different characteristics that we talked about before, about age, we have gender, we have wealth, we have ethnicity, we have disability, and all that. So it means it has to encompass all individuals to ensure that no one is left behind. So the concept of leaving no one behind, it not only entails reaching the poorest of the poor, but it requires combating discrimination and rising inequalities within and among, not just within communities, but also it looks within regions and also countries. So you'd find that a significant number of persons have been left behind, including individuals, families, communities. So we still have really a lot of work to do for us to ensure that no one is being left behind. So inclusion means that everyone, if you look at this image, it means everyone is really they are included. There's no discrimination. There's no group that maybe is left out within a community. So it's not only within communities, so it goes beyond communities. It goes even to countries and even to regions. So it's about fighting to ensure that no one is left behind. So, so inclusion is all about making sure that everyone gets a chance to participate fully. And as I said before, it's not just in the WASH program, it's also within development, within the development spheres, also within the political spheres. So inclusion is ensuring that everyone is given a chance to participate fully. So recognizing dignity, diversity, and autonomy of worth of people and all people's right to access to opportunities with others is all what we talk about in terms of inclusion. So inclusion involves with identifying and removing barriers. We will look at these barriers in the next slide and coming slides. For us to understand, for you to really embrace inclusion, you need to identify barriers and make sure that you're removing the barriers that prevent people from effective participation in the society. So you are able to identify different kind of barriers, and then you ensure that you remove the barriers so that people are able to participate fully, people are able to access services. So for example, in terms of disability inclusion, for example, so you address the multiple barriers that people are facing with disabilities. So we talk about their attitudes, their system barriers, and their physical barriers. So inclusion in a nutshell is really making sure that everyone gets a chance to participate fully. So it's all about effective participation and people also be able to get and receive the services that they deserve. So inclusive development, so when we talk about inclusive development in a community's perspective, is that when development activities include the benefits of the whole community. So think about the programs that you're running. Maybe you're in a WASH program. Do you think that everyone is benefiting in your community? If you're working in a water project, for example, you've drilled a borehole somewhere, or you're doing sanitation, for example, and maybe you're working in a center that maybe you've set up, maybe, for example, a sanitation facility. Is it benefiting the whole community? Just considering the groups that we talked about, for example, the aged, people who are aged, maybe people with a disability, for example, maybe you're working with maybe children, or we have people maybe who have an illness or an impairment, for example. Are they really benefiting from the activities within the community? So inclusive development is all about benefits to the whole community. So targeting and deliberately including people and groups who are most likely to be excluded is what we is what we talk about in terms of inclusive development. You have to target and be deliberate in your programming, for example, and ensure that you are including all people, you're including all groups who you think they are likely to be excluded. So, and also it means you are making changes to how we implement projects and deliver services. So even as WASH professionals, for example, it means that we need to make certain changes on how we implement our projects and how we deliver services. We'll be looking at some of the examples in terms of accessible WASH technologies, in terms of some of the modifications that we may need to make in terms of our technologies. For example, for us who are working in WASH, in terms of technologies, what modifications and changes do you need to make? For example, maybe in a water project, in terms of sanitation, for example, maybe in terms of hygiene, for example, in how you are delivering your hygiene projects, for example. It means if you make these changes, you are now thinking in terms of being inclusive. You're bringing in the aspect of inclusivity because you do not want to leave anyone behind. Just allow me to talk briefly about the needs from the needs-based approach to the rights-based approach. As during the introduction, I talked about that for our session today, we'll be looking at WASH from a rights-based approach, but you need to understand what we mean by the needs-based approach and the rights-based approach. So to achieve equality, non-discrimination, and inclusion in WASH, we need to move from a needs-based approach to a rights-based approach. So the needs-based approach is mostly is being what has been implemented, but there's now a shift from the needs-based approach to a rights-based approach. So the needs-based approach is whereby usually it's an approach to development which involves partners being responsive to the needs of the poor. So it's usually like you are responding to the needs of a certain group that you think maybe they are disadvantaged or they are discriminated against. So the interventions usually they target a specific groups of marginalized people or individuals, and they usually designed to meet their immediate needs. So when you look at a needs-based approach, it usually targets a specific group of individuals, or it targets maybe a marginalized community. And usually the interventions are designed to meet their immediate needs. Maybe they usually have just an immediate need, and it doesn't look at the long-term needs of a community. So although this approach it alleviates suffering or improves the well-being, it does so only for those involved and for the duration of the intervention. As I said, it's usually more immediate needs. It doesn't look at the long term. So if you look at the long term with this needs-based approach, it usually there is very little changes in the system. So people usually remain dependent on assistance, and they usually continue being vulnerable on the random shocks that they come against them, that strike them during their lives. So the needs-based approach is not very sustainable, and it's usually very short term, because it just looks at the short term interventions for a certain group. That's the needs-based approach. But when you look at the rights-based approach, it's usually about understanding the diverse range of people that make up a community that usually have rights. So if you look at a rights-based approach, it's a kind of thinking in terms of like it's broad, and it thinks not only about individual needs, but it now looks at the barriers that people are experiencing to fulfill their rights. So in terms of a rights-based approach, gender equality and social inclusion is usually one of the ways that we're ensuring that it is more rights-based. So rights-based means that we are now looking at a community and you are looking at who within this community, which are the groups that form a community. And so you go through a whole process with the community to understand their needs, the range of people that make up a community, and now you work with them to develop maybe an inclusive program. So such, if you use a rights-based approach, it's usually more sustainable, because as we have said, socially excluded groups usually are in every community, and they have a right to access to safe water and improved and affordable wash facilities in the communities. So if you look at the lens of our rights-based approach, it brings on board every group within the community, and you're able to meet the needs of the different groups, and it's usually very long-term. So as I said before, we look at the different groups. So let's look at gender. How does gender and WASH link? So as we said before, when we're defining gender, so gender is about really it's a social construct about responsibilities and roles that our society really assigns to different groups, or to men and women. So if we look at gender and WASH, we can see that women and girls are usually responsible for the collection of water. So in terms of water supply, for example, or access to water, you would find that women and girls are usually responsible for collection of water, which is particularly in the rural areas. And it's usually a labor-intensive activity. So where there is no source of water, for example, so the task falls to the women and the girls in about 64% of households, maybe in rural areas. So as we said before, in our communities where we live in, or where we are working, you will find that the responsibility. We talked about gender. So gender is about not being a man or not being a male or a female, but it's about societal roles really. So you'd find in most of our societies, you'd find that the task in terms of looking for water is really has been left to the girls and the women. So this as you remember, I talked about there are groups that are likely to be excluded even in terms of WASH. We talked about the women and girls. So you'd find that women and girls are usually tasked with the responsibility of collecting water. So in terms of sanitation, you'll find that women usually are typically responsible for sanitation and hygiene in the households, and also including children. They are also in charge or responsible also for construction and maintenance of sanitation facilities. You would find even in most communities, you'd find that the women, when we're doing a sanitation program, for example, even for the programs that we run, for example, let's say even in CLTS, when we call for a community meeting, you'd find that women are usually the ones who are so many who come, because it's their role really in terms of sanitation and hygiene within households. So that is a role that really falls in the hands or in the shoulders of the women. In terms of domestic use of water, for example, you'd find the women are the primary users for users of water for domestic purposes, such as maybe cleaning, preparing food, washing, and maintaining sanitary facilities. So that role really falls in the hands of the women. In decision making, I love this. I know most of us have come across this image. I think it's been shared almost in many spheres and in many places, which really makes a lot of sense. So you'd find in a community where there's maybe an issue about water, so you'd find that the decisions really are being made by the men, but the ones who are really know about the water issue, where the distance is, maybe about safety, it's really on the women. But you'd find that decision processes in water management and other water projects are often exclusively for men. So you'd find that the men are the ones really who are making decisions about the water management, but the role really about the water, it really falls on the women. So you'd find someone, okay, this quote here, they're saying women, they are too busy to discuss water. They are too busy to discuss water. So in terms of decision-making, the decision-making processes really within our communities and where we work really has been on exclusively among the men. Yet the burden about water really falls among the women. Even if you look within the water wall, maybe in the macro scale, really, in the macro wall, you'll find that women are still underrepresented in the water wall. Even with careers and training really in water management, you still find it's still dominated by men, largely. I'm not saying that there are no women, there are women within the career space, but you still find really the dominance is still among the men. So still with the women and girls, you still find, as I said before, they are at risk for gender-based violence. Maybe, for example, maybe the water sources sometimes are isolated, sometimes they are very far, sometimes they need to access maybe latrines, but sometimes the latrines are not safe. So you'd find sometimes where there are no latrines, sometimes women and girls are sometimes are at risk, maybe going for to defecate in the open. So they are likely, or they are at risk of gender-based violence because of the facilities, because of the way the facilities are being situated or the way the facilities have been maintained. So women and girls are still at risk of gender-based violence when they use or when they want to access some of the facilities. Conflicts and emergencies usually exacerbate water scarcity. So in such situations, you'd find that it becomes a double hardship for women, because now they're in a conflict zone and maybe they're still the ones really still in charge or ensuring that in the households they are getting water. So it becomes really a double burden for women. And it becomes even more harder for them that they're in a conflict situation. Maybe they're going through an emergency, for example, and yet they're still needed to make sure that there's water in the households. So exclusion and poverty among women also heightens the lack of consideration in the provision of MHM facilities. So for example, in terms of taboos and stigmas that exist within communities, So they still affect women in terms of menstruation. So even for girls, for example, that's something we've been talking about in terms about going to school and maybe participating fully. You find them sometimes they're forced maybe to stay at home because maybe facilities are not available for the girls in school. So even so such exclusions really are affecting women and girls. So focusing on and including women in WASH programming, it contributes to more effective and sustainable WASH outcomes, as well as being a good mechanism for gender equality and women's well-being. It's also about voice, about leadership and economic empowerment. So here we are literally being able to see how gender really links with WASH. So agenda approach to WASH, it focuses on the following. There may be many more really that it focuses on, but I just am highlighting a few. That agenda approach to WASH focuses on women and men, and not only women in isolation. So we are not just talking about, as I said before, it's not just like a women's issue, but really looking at the women and men. Generally. So it ensures that women and men's different needs and interests are reflected in development, in the design, in the implementation of water and sanitation programs. It's also about enhancing equitable access and benefits derived from water and sanitation efforts. It's also about enhancing equality and equity. And it's also about addressing both practical and strategic gender needs of women. So when we look at gender, how you can mainstream, for example, let me just talk about it broadly. So this is just highlighted in terms of WASH, but if you look at it broadly, in terms of mainstreaming, so mainstreaming gender, it really begins at the higher level in terms of agenda policy. So there are countries, I know many countries have policies of gender. So it's not about just having a gender policy, but about implementation of the same. And then it comes to another level in terms of institutions. Do we have gender policies within institutions? Even within our workplaces, for example, do we have gender policies? So in terms of programs, in terms of programming, do we have policies that focus on gender in terms of programs? So in terms of implementation, how do you ensure that you are using a gendered approach in terms when you're implementing your projects? So in terms, for example, of even monitoring and evaluation, are we able really to have indicators that show us issues about gender issues within our programs? So it's in mainstreaming gender, even within the WASH, it begins from a higher level. So it begins from policies, even within even in our institutions, and also within our programs. Now let's look at disability. So as we talked about before in terms of disability, so people with disabilities, sometimes we look at them as part of the vulnerable groups, really, but they are part of the community. They are part of every community. So they have the same rights as other people, and they have rights to participate in community and even political lives. So they're not just part of a vulnerable group, but they are part of a community. So they have their own unique strengths, and they also have opinions to contribute. So you'd find most of the time, even in programs, you'd find that people maybe with a disability are unlikely maybe to form part of a committee, for example, because maybe people have a perception like maybe they do not have a voice or they do not have an opinion to contribute, but actually they have their own unique strengths, and as I've said, they are part of every community. Involving people with disabilities in program designs helps you to ensure that WASH provision responds to the different needs. So for example, when you involve people with disabilities in your program design, it enables you might be able to consider water and sanitation technology options, and we'll be looking at some of the options that are really disability conscious in our talk today. So it also ensures that you're using different ways to communicate hygiene messages. As I said, for example, in terms of impairments, for example, if you have, you may need to reconsider how you communicate your hygiene messages. Maybe you can consider, for example, using more of pictorials, or maybe, for example, using Braille. So it enables you now use different ways to communicate hygiene messages. And you can also think in terms of providing additional options and trainings for caregivers. You can maybe focus on caregivers for people maybe who are living with an impairment or a disability. So you can look at option or maybe of training the caregivers. So in terms of involving people with disabilities. So this, I'm looking at it in the context of WASH. You can, when you bring them on board, you're able now to respond to their needs. So in terms of technology, you can now redesign your technologies so that they are more inclusive. You can also rethink in terms of how you are communicating your hygiene messages, and also in terms of how you are reaching them. There may be those who need a caregiver. So maybe you may need to look at options of training caregivers of the people living with a disability. So it's about what we talked about, it's about inclusion. So when you involve them in terms of program design, you ensure that your WASH provisions really responds to their needs. So for example, unhygienic toilets, for example. So it usually impacts disproportionately on people, on the health and dignity of those, maybe like, for example, who have visual and mobility difficulties, for example, because maybe if someone has a mobility difficulty, so they're likely maybe to crawl, and sometimes maybe your technology or your sanitation technology is not really responding to their needs. So you find them sometimes that they are really, maybe it's, for example, stepping into other people's feces, so they are getting more infections, for example. So for example, also in terms of water access, where we are citing our water sources. So you find sometimes that they are distant and inaccessible water points make it hard for people maybe with disability, or maybe people who are old, or maybe sometimes children, to collect water for themselves. So it makes them now more dependent on others, and they're more likely to restrict their water intake and maybe use in an effort to overcome the burden to others. So sometimes the way we design the water points, sometimes the distance is quite far. Sometimes it makes them it makes it hard for people maybe living with a disability to access. Sometimes also it's not about the disability. Sometimes, as I talked about, older persons. Sometimes older persons may not be able to walk to that long distance to be able to get to access a water point. Yeah, so it's all about making and ensuring that we're able to respond to the needs of different groups. So disability inclusive WASH is a process and it's also an outcome. So in a process, as I said before, is ensuring that people with disabilities are able to participate and included in decision making. Oftentimes you'd find that in a WASH programming, I think sometimes we overlook. We sometimes forget to ensure that we are bringing in people living maybe with a disability as part of the process. So as part of WASH development, it's about making sure that we bring in people with different disabilities to participate in and include decision making. And they are the ones also who give us options in terms of technologies, how to make it more accessible and more inclusive to people with a disability. It's also an outcome which is achieved when community members, including people with disabilities, benefit equally from a WASH service. So, for example, water projects would include people with disabilities in the planning process, as I said before, and also in terms of water resource management training, for example. We need to ensure that it is accessible to include members with disabilities. So for example, if we are having a training session, for example, and you have set a site, you have you have a site for the training, and it is maybe the distance is very far. So it means people with disabilities sometimes may not be able to access, or you'd find that you have put a meeting maybe in 4th floor. So people maybe that building is not doesn't have maybe ramps or accessibility to people with disability. So it's about ensuring that where even you set a training for, it should be accessible to members with disability. Let's look at age. So age, we can look at it in different groups. So age, we can look at the young and the old. So in terms of age and WASH, we look mostly in terms of the young people and the older people. So the young is about the children. So the children are usually highly vulnerable to effects of poor WASH, which results in deaths and disease falling disproportionately on children. I think it's something that we've talked about, and all of us know about the effects of poor wash in terms of diarrhea, that it usually affects mostly children. So diarrhea as a result of lack of wash is usually the most common cause of death in children young than 5 years. And I think that's something very common. So even in terms of wash, it's in terms of also about age. Who are we looking at? So today, it can be the children, and also it can be the age or the older. So in terms of children, you can also look in terms of looking at children maybe who are going to school, for example, in terms of interventions. So you'd find most primary schools, for example, you find most of the toilets are inadequate to serve even the needs of the girls. So it results in non-attendance during menstruation. So conversely, school enrollment and retention of girls increases where there is water and sanitation services. So in terms of age and wash, so we have age looking at the young children and also children who are going to school. So in terms of age also, we look at older persons. So older persons, it's not just about maybe the set age within a country. So there are countries who set the age maybe at 60 or at 65 or maybe at 70 to be classified as older persons. But older people also are vulnerable to disabilities and health-related issues, in that when people get older, they start maybe having hearing loss. Most of them maybe start having vision loss. Maybe they start having multiple mobility restrictions. So or other factors such as age-related incontinence, they're not able maybe to hold the urine. So it puts them at a significant risk of being excluded in WASH programming. So it's when you're also designing programs within a community, you have to also look how many older people are within the community. So sometimes you find most of the time that older people have difficulties, as I said before, even in collecting water and using water facility. And so they become more reliant really on others for assistance. The last one is about health. So health, I just picked one, health status, but there are many that we can look at. So I picked one in terms of people living with HIV and AIDS. So they're usually at risk of exclusion because of stigma, where communities prevent them from using communal wash facilities because of the misconceptions about maybe HIV transmitted. So you'd find that people living with HIV and AIDS are sometimes at risk of being excluded from accessing wash facilities because of misconceptions. And you'd find that this group of people are the ones who really need the water service, who need the services, good wash services, because poor access to clean water and sanitation increases their burden and risk of infection. And so it is a group that needs the services very more, yet communities are likely to exclude them because of the misconceptions really about HIV transmission. So in terms of health status, there are many other health status that you can talk about, but this is just an example that the relation between health status and WASH, in that there are groups who really need the service, but sometimes they are excluded from such services. So we will take a short break, and then we will take a short break of just 5 minutes, and then we can come and look at the barriers. We look at how to look at the barriers to access, and then we can look at some of the examples in terms of inclusive WASH. So back to you, Eric.
According to United Nations, it has been established that 1 in 3 people do not have access to safe drinking water, 2 out of 5 people do not have a basic hand-washing facility with soap and water, and more than 673 million people still practice open defecation. These statistics are worrying, and the continued increase of unsafe hygiene practices are a health hazard to many people across the globe. Thus, effective and sustainable interventions are needed to reduce spread of such diseases, which will alleviate human suffering and ultimately save lives. When more people such as local emergency response workers develop a good understanding of water, sanitation and hygiene strategies, more lives will be saved. To help in these efforts, humanitarianglobal.com has worked with world's best WASH specialists to develop a comprehensive online diploma program in WASH that will help participants to acquire enhanced knowledge and expertise in water quality issues. In this module you will get introduced to water quality issues and learn more about water safety plans, water treatment and water quality surveillance and testing. Secondly, sanitation. In the second module, get to learn about sanitation in schools and emergencies, sustainable sanitation and how sanitation links to health, nutrition, agriculture and food security. Thirdly, hygiene and disease transmission. In the third module, you will learn more about hygiene improvement, disease transmission routes and the F-diagram and hygiene perspectives at both household and community levels. And fourthly, hygiene types. In the last module, you will get to learn more about hygiene types such as personal, environmental, domestic and food hygiene types. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.
Thank you for the session, Rose. Thank you for guiding us through the first session. I think at this time I'd like to invite Anthony. I don't know if Anthony is there with us. Anthony, are you there with us? Maybe as we wait for Anthony. Thank you to our participants also. I can see you are still sending in questions, and I still encourage you to continue sending in the questions to the Q&A part of the Zoom, and our team will be getting back to you. And also for those of you who are still communicating on the chat, I believe my team is working on your replies. Just a few of the questions that I have seen so far are people asking for the slides of the session, and we are going to send them after the session ends, hopefully by today, or if not, by tomorrow morning. You should have them in your email. Also, we do have your emails with us. Remember, when you registered, we were able to get them, so that is what we are going to use to send the emails. Maybe just to check, I don't know if Anthony, you're back with us.
Yes, I'm back, and thank you so much, Eric. I hope you can hear me loud and clear.
Yes, I can hear you loud and clear.
Yeah, thank you so much, and also to Rose and to all of our participants for the great session. As we take a quick break, I would like just to share with you some of the areas that you might be looking at when it comes to further training in this area of water sanitation and hygiene. And maybe, Eric, you can confirm whether you can see my screen on your end.
Yes, I can see your screen.
Yeah, sure. Thank you so much. So a quick one before we get back to the session, we do have a training on certificate level, water sanitation and hygiene. And this is a course that is very much in line when we talk about the main agenda for today, where we look into inclusion. And this is a short course that can take you a period of 3 months, and it's very convenient for you to undertake it, despite maybe your busy schedule. Because for this course, you can see based on the structure, you can study it within a period of 3 months. Each module, you do it a month. And then you can easily see now that for each module, again, we've got 4 sessions, 4 sections for you to cover. So based on this one, you can see if you're beginning your career in this path of being a WASH specialist, you can start with an introduction to WASH. So we start from the basics, and then we can take you through to get to understand more about water sanitation and hygiene. We tackle about global availability of fresh water. We also look into rights to water and sanitation, and that is based on the UN development goals. We also look into post-WASH development agenda, and that is what we cover for the first module. The second module, we take you through water sanitation and hygiene, and here we look now purposely on sanitation in schools, which is a very critical concept for you as a WASH specialist to be able to understand more about the context of sanitation in schools. We also look at sustainable sanitation, and then we take you through hygiene improvement, and then we finally look at disease transmission routes, and here we use the concept of the F diagram. So that is what we cover for the second module for this short course of 3 months. And then we also do have the third and final module, which is very much in line with what we are discussing today. And this is a course that you can be able to get to know more about the cross-cutting issues in WASH, some of the emerging trends. So that is what we cover We talk over participation. We look into the aspects of gender. We talk about environment. And then based on what we are talking about today, you can see we have a topic, an entire unit there, talking about inclusion of the most vulnerable members of the society. And here we focus on people with HIV and AIDS, the elderly and the disabled, and also the children. So this is a short course. I would encourage you. And from this meeting, try to go to the website, make application for this course for only $450 because we're going to give you a 10% discount. And as I said, how to do the application, just go to the website, you can go and register now. You can directly go to that page. And the other information, the one that I've shared with you, you can find it on the website again, where you can see comprehensive details for that particular program. So this is where you come, fill this simple form. And once you fill and submit this form, our team is going to get back. And before now we go back, we also do have other levels, and we're going to share this content with you as we send the slides, because we do also cover WASH in the diploma level, where you take a period of 6 months. We've got 4 modules, and you can see we try to cover water quality issues. We have sanitation, hygiene and disease transmission now extended, and then we also look at hygiene types. So that is the diploma level. And then we also now do have the postgraduate level. And for this one, it's a 12-month course. So that is 1 year. You've got 8 modules, and you can see it's very detailed, starting with the first module about water supply in emergencies, pumping equipment, sanitation hardware systems and concepts. We also switch to sanitation software systems and concepts. We look into sanitation in a different context. We also go through again hygiene and disease transmission. We also look at hygiene behavior change, and you can see very much relevant with what most of us they might be doing at the moment. And then we also look into epidemics and management, and also hygiene promotion management, as well as global annual events. So these are courses that we bring to you to ensure that as you attend these webinars, don't get lost like, can I have further training? So this is the further training. For the postgraduate, you only have to pay $1,350 after we give you the 10% discount. For the diploma, it's only $900, and you can be able to register through the website. So go to the website, locate those programs in the online courses, choose the level, you'll get the specific course that you want to enroll, find the details there, and then you can click on register now. So that would mean that you can always now attend the further training classes prepared by Rose alongside other facilitators, so that we can take you through comprehensive training, and also ensure that at the end of the course, you get your certification documents. So with that said, thank you so much. And in case of any question, maybe I was too fast, do not hesitate. Try to chat us on the chat section, and our team is going to guide you on how to get started. So thank you so much, and we look forward to seeing you in these programs. So back to you, Eric.
Thank you, Anthony, for that bit. And we do hope our participants are going to be joining us very soon. I think our time is now up. Maybe we can go back to Rose and invite her to continue with the second part of today's session.
Thank you so much, Anthony and Eric. So just allow me to share my screen again.
Okay.
I hope you are able to see my screen.
Yes, I can see your screen.
Okay, sure. Thank you so much. So welcome to our session, second part of our session today. So as I said before, we want to look at the barriers. So if you are looking at ensuring that you have inclusion within your WASH program, so we have what we call a barrier analysis. So it's a powerful tool in planning for equality, non-discrimination, and inclusion in WASH programs. And also it can be used for other programs, really. But you can tailor it also for your planning in terms of WASH programs. So we have 3 categories of barriers. You remember when I talked about impairments? So like when with an impairment, they usually barriers. So the barriers that I was talking about are the 3 categories. So we have what we call environmental barriers, we have institutional barriers, and we have attitudinal barriers. So example in terms of environmental barriers. So environmental barriers, this exist in the natural or built setting in the way things are constructed and in the way information is delivered. So the key thing here is about the way things are constructed and the way things are or information is delivered. So examples for you to understand about the barriers, environmental barriers. So steps are built around a water point, making access difficult for those with limited mobility. So I talked about this, like how do we construct our water points, for example? So you may find that, or when you're doing your analysis, you realize that maybe the way we've designed the water point access, it becomes difficult for those with limited mobility. Sometimes maybe latrines built in isolated location, making it feel unsafe for some people to use. What I talked about in terms of gender, you find that maybe how we have cited the latrines, it's in an isolated place. It makes it difficult maybe for the women and the girls to access it, maybe because of issues of gender violence. Sometimes also in terms of what I talked about in terms of how the information is delivered. So if hygiene messages are communicated, maybe we're using a radio, for example, to broadcast messages, and you find that maybe people are not able to access. So these are just about barriers, environmental barriers, when you're doing your analysis. So these are just examples of environmental barriers. So it could be how you are constructing a water point, or maybe how you are citing a latrine, or how are you communicating your messages. So the way you're communicating your messages, you may be thinking that maybe if I use a radio, I may be able to get reach. My reach would be maybe great, but you find that maybe the audience that you're trying to reach are do not even have access to the radio, or you are targeting a household and you find that the radio is only owned by the man of the house. So the hygiene message that you needed women and the girls maybe to have to reach, you're not getting their audience. So these are examples of environmental barriers, and there are so many others. These are just examples. So when you do your analysis, so you look at environmental barriers, and then you can look what's really in terms of water access, what's really in terms of maybe sanitation, and maybe in terms of hygiene. The second category is what we call institutional barriers. So these are created by laws, policies, cultural traditions and practices, and sometimes even company policies. So sometimes these are examples, maybe design specifications for latrines that neglect to include facilities to manage menstruation. So you'd find that maybe the laws of the policies within the country, so usually maybe in terms of school wash, for example, you have the country has maybe specific designs for school latrines, but you'd find these designs really do not include facilities maybe to manage menstruation, or sometimes the facilities do not provide ways of disposing maybe used sanitary products. That one now becomes a barrier. So sometimes it's when we are implementing, you're looking at what does the policy say, for example, in terms of school wash, but you find the policy sometimes becomes a barrier. Another one maybe is a lack of standards for the design of accessible public water points. So maybe within the water sector, we have designs maybe for water points, but you find that maybe designs really from maybe the government not provide designs maybe in terms of accessibility. So the designs, this lack of standards in the design for accessible water points for those maybe with limited mobility. Or another would be a lack of information on accessible toilets for households. So this one is in terms of your sanitation, maybe rural sanitation laws, for example, and guidelines within the government. Maybe there's no information that is providing information on maybe different accessible toilets for households. These are just examples, really. So barriers can also be institutional. So it could be the laws, it could be maybe policies do not provide maybe some of the specifications that we need. Sometimes it could also be their cultural traditions really and practices. Sometimes also it could be even company policies. So these are just examples and they can be many. The last category is what we call attitudinal barriers. So these are really more on within the community level and within where the society people live. It's all about the cultures and the beliefs and the behaviors really and prejudices that are really happening within a certain society. So sometimes these are not universal. So these ones, the attitudinal barriers are more within a context or within a society. So for example, what we talked about in terms of people living with HIV and AIDS, sometimes they are kept away from water points because of fear that others may tap or contract the infection. So sometimes this may not happen in other contexts, but at times it happens. This one, maybe another one example is disabled people deliberately not being included in community meetings because people assume that they have nothing really to contribute. And you remember when we were talking about disability, is that people, they also have opinions and also they have ideas. So sometimes you find this is an attitudinal barrier. It's just an attitude among the people that maybe people with living with a disability, for example, maybe they do not even have nothing to contribute in a meeting. So they are deliberately excluded in community meetings. Another attitudinal barrier is assumption being made that women don't have technical knowledge and therefore should not be consulted over water service designs. This is what we talked about when we were looking at gender and WASH. In some of the communities, you'd find that in many meetings or water meetings, you'd find really women are excluded from the meetings because of the assumption that they don't have the knowledge really about issues about water. So even in terms of designs, they're not even consulted. That is an attitudinal barrier. Another one is about the belief that menstruation is impure or dirty and requires women and girls who are meant to live, wash, or eat separately. So this is also an attitudinal barrier. So when you're trying to really have an inclusive WASH program, so you can undertake a barrier analysis within your community to see where are the barriers. So as we said before, when you identify a barrier, so you need to ensure that you remove that barrier. So when you remove the barrier, people now are able to access services. So you have these three categories. You have the environmental barrier, you have the institutional barriers, and then you have the attitudinal barriers. So you can identify a barrier and you need to work on it to ensure that you're removing that barrier for people to be able to access, whether it's a water service, whether it's a sanitation service, or whether it's a hygiene service. Okay, so in terms of in programs, for example, so I'm just giving you now in terms of like the actual, when you're doing a program, for example, in terms of inclusivity. So for example, when you're doing a baseline survey, we usually collect data when you're doing baseline survey. So one way on ensuring inclusivity, so when you're looking at data, you need to disaggregate data with age, with sex, with disability. So you need to bring all those factors or also indicators. So when you're collecting baseline data, for example, you need to ensure that you're collecting data on menstrual hygiene management. You also need to collect data in terms of accessibility of facilities by people with disabilities. You also need to collect data in terms of what are the traditional attitudes about gender, what are the attitudes about disabilities, about age, all in relation to WASH. You can also collect views of children, women, older persons, disabled people, and their households, and also maybe migrants or people who are displaced. So one way of ensuring that you are having inclusivity in WASH is within the program. So for example, during baseline surveys, how do we collect the data? How do we disaggregate our data? In terms of when you're doing community mobilization, for example, are we using participatory approaches that enable different groups to participate? Are we maybe having convenient meeting times and locations? As I said before, sometimes the location of the meeting becomes very difficult, sometimes for women and sometimes for maybe people living with a disability to access the meeting. Sometimes we have meetings at inconvenient times. So we have meetings at a time when we know, like maybe women are busy, maybe we are preparing meals for the children. So that one now becomes really, they are not able to participate fully. So in terms of community mobilization, you use what we call empowering facilitation techniques where you acknowledge every member of the community and give them room to participate in meetings. So that's one way you can do in terms of community mobilization. There are many other examples, but these are just highlighting some of the things that you can do in terms of community mobilization to ensure that you are inclusive in bringing in the issue of the aspect of inclusivity. So in terms of information access, I think this one we talked about before. So you need to ensure like the information that you have, is it accessible to the audience that you really want to reach or the community you want to reach? So as I said before, you can decide maybe to use pictorial information because maybe the level of knowledge is low. As you remember when we said before, the groups that are sometimes likely to be excluded, maybe people with a low level of knowledge or maybe low level of education. So most of the time, if you are, you can use other ways. You can use pictorial information. For those, sometimes you can also decide to use audio. You can use audio. Maybe for those who have not able to see, you can decide to use audio. And so it's all about providing relevant information that's accessible to everyone. You can also think in terms of using Braille, because for those who are visually impaired. So in terms of information access, you can think also in terms of how do you want to ensure that information is being accessed by everyone in the community, considering the different types of impairments that we talked about, and also in terms of what we talked about in terms of the groups or groups that are likely to be excluded within communities. So in terms of user committees, for example, this is an example for water, for example. So it's about including women and members of other marginalized groups for meaningful participation. And it's not only about having them within the committees. We have seen examples where people are reporting that in our, maybe a water management committee, we have included women. But you'll find that the positions that they have not been given any meaningful position. So they're just there like flower girls, really. So we've not given them leadership opportunities. So it's not about just having them as part of a committee, but giving them leadership opportunities. Leadership opportunities, they can be maybe like the chair or they can be the treasurer. So for such positions, people now have a voice. They can now talk and they can make change. So when in terms of being part of committees, it's not just about having them as part of the numbers that we have 13 members in a committee and we have maybe 8 of them are women, or maybe 3 of them are from the marginalized group, or 2 of them are people with disability. But are we giving them an opportunity to really to provide a leadership? So it's also in terms of decisions on tariffs. So like, for example, these are examples in water. So decisions on tariffs. So it should be able to include options for the poorest and those who are unable to pay. So when you're setting tariffs, for example, for a community water project, when you say maybe you want to charge maybe $1, or maybe you want to charge maybe 0.5 of a dollar, maybe for a 20-liter jerrycan, for example, are we including options for those who are not able to pay for that money? Or how are we going to account for those who are actually not able to pay? So it's when you make side decisions, so you need to ensure that you are looking through the community, your community, how many people really are not, or households are not able to pay, how many people maybe can pay maybe $1, how many maybe we can set for them maybe less than $1, so that everyone is able to access. So in terms of monitoring and evaluation, so when we set indicators in terms of M&E, it should be able to reflect, these are just examples, in terms of facilities. So how many of the facilities that we have put up that have levels of accessibility, so that it's not just a blanket, like people are having access to water, but we need to ensure that how many facilities really have specified levels of accessibility to different groups within the community. So in terms also about indicators, it should reflect the numbers in terms of the most marginalized, lacking access and use of the facility. So it's all about here, it's about we're looking at we have a certain number of people maybe who are marginalized. So we should be seeing reduction in numbers of people. So what it means is that we have more people who are marginalized having access and using the facilities. Also, it's about increased participation of marginalized community members in active roles within with responsibilities. So these are just examples in terms of indicators when you're looking at for the teams that are looking at monitoring and evaluation. So it's not just about 20% of people are accessing water, maybe 40% are accessing sanitation facilities, but we need to look and disaggregate our data more and look more in terms of, okay, as much as we're saying people are having access to water, what are the levels of accessibility for the different groups within the community? For the most marginalized, for example, how many really having access and how many are still having difficulties? So in terms of participation, how many people or groups are participating in active roles and responsibilities? So as I said before, let's just look at some examples. These are just examples, there are still many. I picked an example from UNICEF in terms of participation, and it's more about female participation in key posts. So this is in Vanuatu. So UNICEF, they did an analysis to see whether female participation in key posts in water user committees was associated with improved functioning of water committees and systems. So if you look at the pink is where there were no women in committee posts, and the blue one, there is women in key committee posts. So in terms of functioning, the water system functioning, so you would find that in those which were good, you'd find that women were in key committee functions. So for this first one, for example, that functionality was at 80% when women were given key posts within the committee. So in terms of fee collection, so they also looked in terms of where there were no user fee collected. There were no user fee collected, but so when there were no user fees collected, there were no women in such committee posts. But when the fees collected through the year, there were women. There were women in key posts. So you find in this at 130% here is when women were put in key committee posts. So what this one tells us is that it's all about what we talked about, participation, and it's not just giving women a role, bringing in women to be just part of the committee, but giving them active roles within a committee. So this is just an example of a successful participation of when you put women or female in key posts in a water user committee. Let's now look in terms of technologies. So in terms of these are just technologies. So in terms of paths, so this one I just called paths. So when you so paths are needed should be really suitable for everyone, and particularly users with visual impairment, and maybe with physical impairments, maybe, or also people with wheelchair users. So these are just examples. So if you look at this first picture, so it's about this is someone who is visually impaired and should be able to access a sanitation facility. So the way the designs has been made, they've put what we call landmark posts, which are made from locally materials. So this one is able to tell this person who is visually impaired that they are on the right path to access maybe a sanitation facility. Another way, the second photo here, is that the path is clear and it is level and it is lined with rocks. So the rocks is able to tell this person that they should not deviate out from the path. So these are just guiding this person who is visually impaired to be able to access a sanitation facility. One other way, you are from the third photo, is where they use a string. So this is a string that guides the person from the house to the latrine. So this is someone also is old and is visually impaired. So when they use the string, they should be able to access a latrine. The second one we want to look at is in terms of ramps. So there are ramps, these are ramps really. So this one, it's if you look at this ramp, it is wide enough to access an hand pump apron. So this one really can be used by even people with a wheelchair. So when you do a ramp, the concrete ramp is wide enough. So you look here, it's wide enough. So someone even who uses a wheelchair should be able to access. The second photo here, so the ramp also should have a low gradient. So when you're looking at the ramps also, you look at the gradient so that it is also provides, it's also safe for people who are using a wheelchair, so that they are also be able to access it very well. So the third one also is still about the ramps. So this ramp, it is movable, it is a wooden ramp, and so it can be used to access facilities with steps. So if you find that facilities have steps, you can use this movable ramp. So it means even people who have a wheelchair, for example, should be able even to access a facility. So these are just what we call accessible technologies and modifications that you can make, even in terms of our WASH programs. So you can look at when you're doing your designs, how you can make the ramps, looking at the gradient, looking at the wideness of the ramp. So also in terms of sighting, as I talked about before, so let's say, for example, it's about maybe people who are a bit old, they're not able to walk long distances. So it's about sighting. So in terms of sighting, so you should make sure that even where you sight the latrines, even for older persons, they should be not more than 15 meters from the household. So if you see, even an elder person should be able to walk really not very far, so that they should be able to access a latrine. As we talked about earlier before, sometimes when we look at sighting, sometimes we sight them very far, they become so isolated, it becomes even difficult for people, maybe even not only mobility, even with age, they're not able to access the facility. So it's all about sighting. Another example, so in terms of entrances to latrines, so if you look at entrances to latrines, you also need to make sure that they are wide enough so that maybe someone who has a wheelchair should be able to have access and have good entrance even to the facility. And also if you look at the floor, it's ramped. So it's ramped, it means it's not very slippery, so that at least someone is able to access it very well. You can also look at the second picture. So this latrine, it has a level concrete entrance, and also it is wide enough for a wheelchair user. So entrances, it also goes with what we call the space. So the space within, when you're designing latrines for people maybe with who use wheelchairs, it should have enough space even inside, so that they should be able to maneuver, or they should be able to move within the facility. So it's also about entrances. The entrances should be really accessible even for people who have wheelchairs. Oh, in terms of water points, so in terms of water points, as I talked before, if you look at this community borehole, it has a wide circulation area and a pedestal for the container. So a wide circulation area really it's for people who for individuals, maybe who need to get water and they have a wheelchair. So it has a good circulation area. And then sometimes also what I talked about here is this pedestal. Sometimes maybe we have older people or who need maybe support to be able to place a container before they carry it. So this pedestal also helps in terms of ensuring that at least they have a place to place the container. Okay, so the other one also, as I said before, if you look at this community borehole, the circulation area, so it is also raised, and you can see that someone even with a disability or who has a wheelchair should be able to access and be able to get water. So it's how we design the apron area or the layout of the apron for those who are working on the water points. In terms also of water points, it's about the pumps. I know we all know about these water pumps. Sometimes the handles are usually sometimes very high. Sometimes you find that even children are not able even to reach them. So this is an example of a modification of a pump handle. So the P handle, so usually the handle is usually maybe like this, but this one, it has been modified. So someone is able even to use it. So it's a P handle. It looks like a P. It's a P handle. So it has a hollow pipe that slides over. It is an Indian Mark II pump handle, really. So this one, even someone can be able to pump water even from the sides. The second one is still a pump handle. So it is a bend, this is a bend T-bar. So it slips over the end of the standardized bump. So this one also, it means that people can still be able to use it, even children can be able to use it. So these are just modifications so that our wash facilities really are inclusive and accessible to all. So this is in terms of water points. These are also other modifications in accessing stored water. So maybe the water has been brought to the house. So this is an example of a jerrycan tipper. It is made it is a jerrycan tipper. So this is really helpful for someone who is not able maybe to stand. So someone who is not able to stand should be able even to access stored water. So this is an example of a modification really for someone to be able to access water. So this one is also suitable for children or people with limited strength, or people with difficulties in bending or lifting, or people maybe sometimes who have poor balance, or some of them, or some who maybe only use one arm. So such modifications are really helpful. The second picture is also like if water even has been stored in a bucket, but it is accessible via tap. And also you'll find that it is also lowered so that someone it's not very raised. So someone, even if someone has a limited mobility, they should be able to access stored water. The last one is on hand washing. So even hand washing, how we design or how we encourage households to design hand washing technologies. So this one, it has been lowered so that it is tipped and it's also lowered. It's so someone should be able to, even if someone is not cannot stand, so they should be able to press a foot on the stick, this one, and should be able to wash their hands comfortably also. So the hand washing is not raised like the one that we usually design. So this one has been lowered so that someone, even if someone is not able to stand, or even can be used even by children. So these are just examples of accessible wash technologies in what we call inclusive wash. There are many, many other examples really that you can think about. So these are just I picked examples, but we still have so many ways in which we can ensure that we are having inclusive wash. So these are just examples in terms of technologies and also in terms of participation. And I believe we've learned something, one or two, today. So as my colleague had said before, that you can enroll in one of our courses and you can learn more about inclusive wash, and also in how we to ensure that you're including gender, disability and social inclusion in your wash programs. Thank you so much, everyone. Back to you, Eric.
Rose, thank you so much for the second part and for the conclusion of it. And maybe in the same spirit, I'd just want to encourage you just to go to the Q&A. I can see we have a few questions that our participants have sent. Maybe we can begin with that.
Okay, thank you so much. Okay, so there's someone who's asking, how are we including GEDSI in wash sector at system levels interventions? So as I said before, the way we in terms of mainstream, it's all about mainstreaming, and I said it has different levels. So there are different levels, maybe at the national, let's say for example, national levels. Really, do we have gender policies within the national levels? And then within institutions, we need to have policies within the institutions. So within the institutions, that's why when we're looking at the barriers, for example, we looked at institutional barriers where maybe policies really need to not consider maybe gender and maybe disability. So we have to look into the policies within even institution-wise, and even within our workplaces, for example, because we cannot be working in gender and social inclusion, yet as employees, for example, we are not even aware. So it's all about also in terms of within the workplace, are there policies really that guide in terms of how we mainstream gender, even within the workplace and also within our programs. So it's also about organizations, how they have really entrenched and embedded gender and disability within their programs. Okay, then there's someone who's, I think this is just a comment. It also includes perimenopausal women. So I think it's part of the groups. As I said before, when we're looking at the groups about, when we're talking about the groups that are likely to be socially excluded, we talked about maybe women, maybe or children. So, but they are still, it is still, the groups are still wide. So those are just, I'll just giving examples. Okay, thanks so much. Okay, Mohammed also is talking about, okay, medical and social models are two things. Yes. Yeah, I understand. When we're talking about impairments, so there's a medical perspective and also there's a social perspective. So for us, we're looking from a social point of view. So I said, yeah, there's a medical point of view that, but for us, we're looking from a social perspective. Thank you so much, Mohammed. Okay, there's someone who's asking about how individual factors of disability and gender interact. Okay, how individual factors of disability and gender interact to impact WASH access. Okay. Okay, how individual factors of disability and gender interact to impact WASH access. So I said for the factors, really, if you want to, you may, maybe we're not going through the analysis, but now that you've understood about the analysis, so they are attitudinal factors, really, they are institutional factors and their environmental factors. So it's about how you analyze first the factors, then now to be able to know how to remove the barriers so that you may know which is the barrier that is causing even an individual from accessing water services. So I think after we've gone through the barrier analysis, you are now able to see that there are factors that are more even attitudinal, but they look more of individual really, but they're more attitudinal factors that can really cause maybe an individual or even groups of people not to have access to services. Okay, someone is saying that disability may not be considered as vulnerable. Okay, thanks so much, Samuel. So you're saying in your experience, it is those whom we are talking considered all are vulnerable. Okay, I get your point. Okay, so I said before, sometimes we consider disability as they are really vulnerable, but it depends on the lens that you're looking at it. Because of the, when we talked about exclusion, sometimes, but if we talk about inclusive, if you talk about in terms of inclusivity, when you bring people on board, you realize really they're not really vulnerable. It's about really, if you are bringing them on board in terms of inclusion, in terms when you're doing any development, really, even within the political space. So it's not really vulnerable, but it depends on the context that you're talking about. But if you look at it critically, when you bring people on board in terms of when you're having, even within a community, when you bring people together, you'll find that really people they have opinions and they also have ideas, and that they are also able to give even views in terms of even the designs. Okay, I'm trying to scroll. Okay, there's someone is talking about transgender. Okay, yeah. What about transgender and who have real challenge of using public sanitation facility? Okay, I get your point. So transgender also they're still having, those who are transgender are still having challenges in using public sanitation facilities. And I've seen in other contexts where they have 3 types of sanitation facilities. So they have for male, they have for female, and they have what we call neutral. So about transgender, there are other areas, they've been areas that have embraced it. And as I've said, they've designed facilities that are able to cater for them. So even the transgender, they're still part of the groups that we talked about. They're likely to be excluded. So I know it's still a challenge, as you say. It's still a challenge among the many, even within our communities. But there are areas that have really been able to really consider them. So they have sanitation facilities that are neutral. Okay, so I'm seeing this. There's so many questions. I may not be able to. I may not be able to answer all of them. So there's someone who's talking about, have you considered language diversity and ethnicity as barriers? Yes. You remember when I talked about exclusion, I talked about we can have even minority groups. Sometimes you can have even ethnic groups, sometimes who are minority within maybe a region. So sometimes those ones also are usually considered, they are likely also to be excluded. Okay, thanks so much. I'm also seeing it. Some of them are comments. Some of them are comments. Okay, I just read one of the comments. Someone is Fanwell, who said, I wanted to point out that with access to sanitation facilities should not only focus on access, but use of latrines through inclusion of handlebars and also inclusion of the disability friends with. Yes, so as I said, the examples that I gave in our discussion today, those that just I picked up a few examples, but there are many ways in which we need to ensure even latrines are also inclusive. So in terms of also the squat plates or the squat pants, so there's a way also to ensure that they are also disability inclusive. Okay. Okay, so I may not have time for all the questions, but we can post the questions on the community group, and then we'll be able to pick up the discussion from there. Okay, back to you, Eric.
Thank you, Rose, for that. And I will be showing our participants where to post the questions on the community group, just to follow up with the conversation. And at this time, we'd like to allow some of our participants to ask questions. And to do that, to our participants, I'll kindly urge you to raise your hand on the Zoom chat, just there below, next to the share screen. There's a raise hand option, and I will unmute your microphone and give you a chance to ask our facilitator a question. And I can see a few hands already. Rume William, you may unmute your microphone and ask the question.
I raised my hand before, but
Yes, Rume, we can hear you.
you're getting me, huh?
Yes.
Yeah. My question was, like, if we look at the pictures, the examples for the wheelchair, I saw one about the gradient. The last picture for the gradient, I don't think people with wheelchair would be able to climb up because it's a bit raised up. If Rose can go back to the slide, yes. The last one about gradient.
Gradient.
Yes. Not that. Yes. So you see the movable wooden ram. I can see it is like a bit up. So it will not be difficult for people with wheelchair to move as they ride up there because it's not a bit flat. The last picture.
Okay, I get you.
Yeah.
Okay, thank you so much. Okay, so thanks. So in the designs of the gradients, so they are usually the the range. So the gradient should not be more than 1 to 20. But okay, maybe you may not understand. So maybe I'll share in the community group the designs for the RAM. So there is a gradient. There's a gradient that is usually required so that it's not very steep, so that people should be able to access it. So maybe from the photo, it may look a bit, it may look like it's a high, but they are in the designs, it's usually given that it should be not more than 1 to 15 in terms of the gradient. But I can share that in the group, in the community group. Thank you so much for raising that.
Okay, welcome.
Yeah.
Thank you for that, Rume, and I hope we were able to answer your question. I can see another hand up. Tambie.
Good morning.
Morning.
Yeah. Mommy Rose Ekanego, a good presentation, a nice one. I'm from Sierra Leone anyway. Concerning the Sustainable Development Goal 6, it is a target that we are trying to achieve by the amalgamation of countries. It is a global concern. In striving for clean water for all, though 40% globally are not are out of it, what are the barriers mitigating this accessibility of safe and clean water in our communities in relation to equality and equity? Now, we discussed on equality and equity. thinking about the accessibility as far as WASH is concerned. How actually, because as you are saying now, 40% globally, the opportunities that the Sustainable Development Goal 6 is bringing to the people across the globe, 40% are not benefiting from it. What are some of the accessibility, the mitigating factors or the barriers that are actually limiting the accessibility of clean and safe drinking water to the people? That is my concern. Factors that are like limiting the accessibility of safe and clean water in our communities for national development. A case study of Sierra Leone.
Thank you so much for the question from Sierra Leone. Okay, so okay, so I get your point from a country perspective. So there are many other factors really. So it's not just about inclusivity and ensuring maybe people maybe with different disabilities really accessing water. So from a country perspective, there are many factors really that are still hindering our countries, even from sub-Saharan Africa, from even achieving even the targets. So you'd find, for example, even as much as maybe financing would be a key issue really for countries to that all the populations are having access to safe water and sanitation. But there are other factors that come into play. For example, the issues about hunger, about drought, sometimes about maybe conflicts. Such things sometimes deviate maybe on bring issues. Those are some of the things that really maybe come and interrupt the country's progress. So you'd find like the focus now shifts maybe to maybe other things. So it's still, from a national point of view, from even many of the African countries, we're still a bit far from even achieving some of the really the targets. So there are really many factors really that contribute to that, and we may not be able to maybe really address even here. But if you look at it from a global scale, for example, you still find financing really still an issue, because even you find, for example, even in terms of sanitation, you'd find many countries even do not allocate enough funds, even from the national budgets really for sanitation. So that still becomes even a big issue, even in terms of really ensuring that we are meeting even targets for sanitation within the African region. And so there are other factors really that come into play. So and also in terms of what I talked about in terms of maybe even policies, I don't know, different countries have different policies really in addressing so many issues. So there are many really factors that come into play, because we're not just looking at SDG 6 really, we are looking at the other 17 countries are looking at the 17 SDGs. So thank you so much for that.
Rose?
I think Rose is having a small technical issue. Earlier, we'll have her contact you. Rose, are you still there?
Yes, yeah, I can hear you, Eric. Sorry for that.
It's okay. I can see another hand up. We have Garamu Adisa. Garamu, you may ask your question. Okay, let's wait for Garamu. I can see another hand up. Roach Kabur, you may unmute your microphone. Roach, are you there with us? You may unmute your microphone. Okay, as we wait for Roach, we have Shukri Ali. Shukri Ali, you may unmute your microphone. Shukri, are you there with us? As we wait for Shukri, I have Daniel Magok. Magok, you may unmute your microphone.
Okay, good morning, everyone.
Morning, Magok.
Yeah, as you heard from Eric, my name is Daniel Magok from South Sudan. I just would like to, first of all, thank and appreciate the presenter for the wonderful presentation she made. And with the pictures she shared, I have seen P borehole and bent T borehole, which I have not seen in all programming. And my question is, this is good for learning and maybe for inclusivity. And I just would want to know, how do we really find this, and what do we get looking at the population and the type of the design that we are doing? Because these people living with disabilities are scattered from within the communities. How do we approach that? How do we do that approach?
Thank you so much. So as I said before, it's all about when you're designing or when you're during the planning process, or when you're doing even your surveys, you need to identify in the area that you're working in, how many. If you do in a community that you're working, when you do like, for example, a survey or even a community meeting, you should be able to know how many people maybe have challenges with mobility, so that even when you come and design, and I said even during the design process, if you bring in people with disability, they can also help you understand how you may need to do modifications. So because what we talked about here really is about just modifications. They're just modification. These are just the normal handles, but they just made a modification just here on the handle so that people should be able to use it. It becomes more friendly. So it's about how it begins from the design or during the process of planning. When you bring in people with different or from the different groups as part of the planning process, you're able now to see if we put up maybe a pump, all people able to access maybe the water, for example. So it's all about during the process of planning and also implementation. When you bring all people on board, you should be able now to make modifications on the designs. Thank you.
Thank you for that, Rose. And Magok, I hope that was clear.
Yeah.
Thank you so much, Magok. Yes. I can see another hand up. We have Lisok James Moses. Lisok James, you may unmute your microphone. Lisok James Moses, you may unmute your microphone and ask your question.
Thank you very much. This is Lisok from Juba. Actually, yes. This is my first time to attend such a meeting on WASH programs. Some time back, I tried to enroll to the institute, but because of an online thing, these days there's a lot of online scam that I could not believe. But today, I think it's been a wonderful moment, and I want to thank you very much. I actually do not have any question, but I just want to say thanks a lot. And in next coming months, I will definitely enroll and join you guys and do my course on WASH. Thank you very much.
Thank you, Lisok, for joining us. And maybe on the chat section, you may leave us your contacts so that we may be able to get back to you. Thank you so much for that. I can see another hand up. Ali Hassan. Ali, are you there with us? You may unmute your microphone.
Yes, thank you. We have gained through this session very good lesson from our expertise lecturers. And now my question will be, as a community level, what is the highest priority of inclusion with both communities in men and women? I would like to know more very depth about that question. Thank you.
Okay, I'm not sure I got your question well, but as we said before, so when you're doing in any WASH program, for example, even at the community level, it's all about listening first, understanding the needs of women and men. So there's no priority that we're giving to any group, because we said in terms of equality or equity, we want everyone to have access. So it's not about prioritizing women or prioritizing men, but just looking, understanding within a community setup, the needs and priorities within a community. So I will not say that maybe in a community, let's prioritize the men or let's prioritize the women, or let's prioritize the children. So it's about, if you go and read the slides again, it's all about just addressing the needs of a community as a whole and ensuring that we are bringing in the different groups within the community as part of a planning process and also in part of implementation.
Thank you. I would like to add the second question related to this. Do you mean the services must be equal to all and be inclusive, or you mean the structure should be inclusive?
Okay, so it depends, as I said before. Okay, you can look at it in terms of we may not be able to meet the needs of each and every group, but we know when you look at it from a community perspective, are we able at least to ensure that people are having access? So for example, if we're just making, I'm just giving an example, it's not just about the technology, but it's also about the process. So as I said before, even the process is, let's say, for example, even if you are calling for a community meeting, for example. So when you call for a community meeting during community mobilization, that's just a process. It's not about a technology. Are you ensuring that you're setting a meeting in a venue where everyone in the community is able to attend, for example? Are you maybe setting the community, the timing, for example, in terms of people really available at that time? So it's not about the inclusivity, it's not just about the technology. These are just examples of inclusive technologies, but there are many, as I said before, there are many other ways that you look in terms of inclusivity. Like the example I was giving for in terms of participation, women participating in a user community meeting. That's just in terms of participation. Okay,
yes,
thank you.
Thank you very much. Well understood, and I appreciate for your patience and responding to my questions, and happy to be with you and now and forever.
Thank you, Ali Hassan, for that. We really appreciate, and we hope the question was well answered. I can see another hand up. David Black, you may unmute your microphone and ask your question.
Yes, I just want to say thank you for the facilitator and for the team. It has been a very nice session, and I just wanted the facilitator to give me a recap. I picked an interest in the point of when she was talking about the needs-based approach and the right-based approach. I think it's one of the interesting approach, and that I think we need to integrate it into our programming. So may her please kindly just try to give me a very brief recap again in that session. Thanks.
Okay, thank you so much. So let me just go there briefly just for a minute. So as I said before, when we're looking at what we're talking about today, it's more about a rights-based approach, because if you remember the definition that I talked about when we were beginning, is that access to water and sanitation is really a human right. And when I talked about needs, it's about looking at a community and addressing their needs. Just allow me to go back there. Okay, it's a need. So most of the programs, really, if you look at them critically, has been mostly looking at the needs-based. So needs-based doesn't look at maybe what is the composition of a community, like how many people really maybe are disabled, how many people have impairments. So it's usually like just a blanket way of just addressing maybe a need within a community. So it's usually very short term. So individual interventions are usually just targeted for a group, and usually to just meet their immediate needs. But if you look from a rights-based approach, so a rights-based approach looks at it in terms of inclusivity, understanding like people, a diverse range of people make up a community. So before you do any intervention, you look at the community. Who are the people who are making up this community? And you're trying to ensure that you want to bring them on board so that your approach is more inclusive. That's what we talk about in terms of right-based approach. So if you compare with the needs-based, so the right-based approach is more inclusive, and it looks from a point of view where it looks at the community, that our community is made up of people of a range of people, and all of them have a right to development. So instead of thinking about individual needs, this approach looks at what barriers people experience in fulfilling their rights. And the barriers is what we've talked about. The maybe institutional barriers, it could be attitudinal barriers, or it could be environmental barriers. So a more rights-based approach is more inclusive if you compare it with a needs-based approach. Maybe after this, you can still read more on the slides and you may be able to understand more. Thank you.
Okay, thank you so much.
Thank you, David, and I hope that was clear. I can see another hand up. Abdikadir Maalim Hussein. You may unmute your microphone. Abdikadir Maalim Hussein, you may unmute your microphone. Abdikadir, I don't know if you're there with us. Abdikadir? Maybe as we wait for Abdikadir, I can see we have a Fanuel Omoro. Fanuel, you may unmute your microphone.
Hello all.
Yes,
Can you hear
Fanuel?
me?
Yes, I can hear you.
Mine is not more of a question, but just a comment, because I'm hearing people asking about the needs and between the needs and the rights. When you talk about gender and inclusivity in terms of disability, we know needs, basically you can say people need water, people need latrines, but not everybody in the community would be able to access the same services. That's why we're talking about the rights-based approach in terms of programming, because now you go to the community, try to engage them in terms of how can we make it very, very clear that these people with disabilities, maybe they're disabled, maybe they're women, in terms of the GBV issues, in terms of access, location and stuff, in terms of the wash infrastructure, they're able to use them very okay and basically be comfortable enough to go to those places, use the latrines, collect water without any effect on them. And also the people, the disabled themselves, when they move around, the blind people, the people that are using the wheelchair can also use the facilities. Because now you find that most of the time we find, like what our colleague from South Sudan was saying, that they've never seen those kind of boreholes in South Sudan. And I know that those ones were there before when the funding was there, but now with the crisis in the world, we find that in terms of raising funds for water and sanitation, being that access to drilling boreholes and building latrines are very financially intensive. They use a lot of finances to construct. So you find that if you go to a community and you have that limited funding for a service that you want to offer to the community, you engage all aspects of the community, from the women, from the disabled, to the youth, to the girls, if you're working in schools, to find about exactly how comfortable will they be able to use these latrines, how comfortable will they be able to access these facilities so that they can basically use them. Because when they access them, even the community themselves that are not disabled, let's say the one that are working and they have 2 hands and eyes they can see, can also use the same facilities without basically disenfranchising the ones that are basically disabled and might have difficulties accessing them. So when you look at part of that, the approach is basically working with the community before the inception of the project, and then going back again and looking at the project that you are going to implement based on, not on the needs that people need water and latrines, but based on the fact that all people within the community might access the same facilities. Thank you. That was all I wanted to say.
Thank you, Fanuel, for such a great insight. I don't know if Rose has anything else to add on that.
Thank you so much. I think Fanuel expounded it more. Yeah, thank you.
Okay, thank you, Rose. And ladies and gentlemen, due to time, allow us to take the last 2 questions. We will be driving some of the questions to our communities where we can have a bit of more time to discuss and digest all the information for today. So just allow me to take 2 more questions. I can see Augustine D. Blama. Augustine, you may unmute your microphone. Augustine, if you're there with us, kindly unmute your microphone. As we wait for Augustine, I can see Ilyasu Abubakar.
Yes.
Yes, Ilyasu.
Morning.
Morning. Good afternoon from this side.
I'm calling from some of the very critical issues of gender and then disabled. I think there's a lot that is going on in terms of technology. We have a lot of improvements and innovations. Looking at the type of tabs that have sensors where you could use for effective hand washing. I think it is important that such kind of webinar take a look at how to improve on such tabs with sensors in such a way that the blind can also have access to this kind of task. Because if you can see, how do you even assess where the positions of such tabs are?
Ilyasu, I don't know if you can hear me. Ilyasu, your network. Yeah, your network is a bit unstable. We cannot hear you very well. Maybe you may repeat the question, or you can type it on the Q&A, maybe, for us to get back to you.
Okay, let me use the Q&A. Let me use that.
Okay. Okay, Ilyasu, thank you for that. I think at this time, as we wait for Ilyasu, I'd like to invite back Anthony. Anthony, I don't know if you're there with us.
Yes, I can hear you, Eric, and thank you so much for that wonderful presentation and taking us through the Q&A. So as you wait for the question, the Q&A, so you can keep an eye on that so that we can answer that last question before we can be able to terminate the session. So with that said, I would like now also to just in a brief way show our participants about the community forum, because you can head there, post the questions, and then even after the session, we can continue to engage you and also give you responses. So I would like to refer you back to the website because the website, that is where you can find the link. And we have been sharing the same throughout the session. So just allow me in a quick way to orient you on how to access the community forum. So I don't know whether, Eric, you can see my screen.
Yes, I can see it now.
Okay, great. So this is the homepage for the humanitarian global website.com. So just head over to that website. And here you can find all the resources and content that we have been talking about today. That includes the training programs, how to register, other resources that we offer for learning. You can always interact with them there. So however, now I would like us to focus on the community forum because this is the platform where we can have now us sharing the information amongst ourselves. You can post questions. So once you click on that link, you will be redirected to the community forum. So in the community forum, it's very easy for you to sign up. So you'll see there's an option for you. If you are yet to sign up, you'll see there's an option around here for you to sign up. So once you sign up, you just need to use your email address, set up a username and a password, and then you can log in. So once you log in, this is the menu. And once you click on the menu, you can select the forum that you want to be part of. So for instance, you might choose a WASH forum. So you can come here, you can even introduce yourself. So we have a topic for introduction. And then in case now you have a question, you can post it as a new topic. So come here, choose a title for your question. It might be tied to today's agenda for the webinar. So you can choose that. The forum is already selected, that is WASH, and then you can type your question here. So you can type your question here. And then once you've done that, make sure that you can click on create topic. So that would mean that we get a notification that you have created your topic, and then other participants, they would also get a notification, and then we can start contributing to your topic. So you could even see, I think his name was Fanuel, if I got it right. He has a lot to share, and I would encourage you, Fanuel, and also other participants, let's join this community. There's a lot that we can share amongst ourselves. And for this platform, it's a free of charge platform. There's no any subscription fees. You can always get to even share it with your colleagues, with your friends, so that they can join, and together we can be able to learn from each other. So also on the same community forum, you might be working on a certain initiative. You can come and try to locate the forum for SDG. And here you can share. You can see we have a topic for sustainable development goals and work. So once you click on that topic, you can go through the comments so that you can see what people are doing in the organizations, because this is where we share work that we are doing. If you have an organization that you're working for, maybe a CBO, any humanitarian work that you're doing, you can share that here. And that would give you the platform to share your story with the entire participants present in the forum. And then lastly, so you can even see some of us have been able to share these kind of stories. So we encourage you to share more and more. Lastly, as I wind up, we also ensure that we can keep you posted with our upcoming webinars. Like today, you can see, if you go back to the latest, so click here, and then you go to the latest topics. That would now give you a list of some of the recent topics that we have created. We have one on the webinar that we had for the month of September. So you can see all the upcoming ones. Like today we did one on WASH. On this Saturday, we have one on procurement, where we'll talk about understanding supply chain risk and how to manage them. So that would be 10 a.m. to 12 p.m. So the same time, East African time on Saturday. And we encourage you to join. If you have friends, colleagues who might be interested in that field, you can encourage them to join. You're also very much welcome for you to join. And then next week, we have one on disaster risk reduction and management. So you can also join for that one. For the previous ones, you can find the recorded version there, and you can go through and access them. So lastly, allow me to comment about the YouTube channel, because that's where now you can find all the sessions that we have done. So once you go back to the website, try to locate this link. And once you click on the YouTube channel, you're going to be redirected to the YouTube channel. And this is where you can find now the comprehensive listing of all the webinars. So all the webinars, starting from the first episode that we did across the different areas that we cover, meal, wash, procurement, human nutrition, maternal, infant, and young child nutrition, disaster risk, you can find all of them here. So share the link with your colleagues, with your friends in your social media networks, it on WhatsApp, so that others can also get to review the same and benefit. So that is all from my end, and we don't get tired to remind you that you can enroll for a course with us. We are very much ready to have you on board. Come and train with us, get to acquire the skills, share your knowledge, learn from the experts, and at the end of the day, we can all get these skills and make the world a better place. So as we wind up, I would like to leave you with some of the course outlines for the courses that we offer, so that you may go through them and get to see how they're going to be impactful as you look forward to streamlining your career in water, sanitation, and hygiene. So thank you so much. And from Humanitarian Global, we wish you the very best. May you have a great day ahead. So let's now have a look, and we can be able to see the programs that we offer.
In accordance with UN, it has been established that water scarcity affects more than 40% of the global population and is projected to rise. In addition, over 2.4 billion people lack access to basic sanitation services, such as toilets or latrines, and many communities are increasingly being exposed to a myriad of public health hazards and risks. Thus, WASH forms a key part of many humanitarian response programs. HumanitarianGlobal.com has worked closely with experts in this field to develop a detailed online postgraduate diploma that offers extensive knowledge and information resources about this practice area. In the provided 8 modules, the learner will get to learn about water supply in emergencies. In this first module, the participant will get to learn more about intervention context, sphere standards, and consideration for linking relief, rehabilitation, and development. Secondly, pumping equipment. This module will cover the various pumping equipment used in WASH, such as hand pumps, centrifugal pumps, hydraulic ramp pump, and the forms of energy sources that can be used in powering these pumps. Thirdly, sanitation hardware systems and concepts. The third module will cover basic concepts of sanitation, sanitation options, dislodging of pits and septic tanks, and reuse-oriented sanitation technologies. In addition, you learn more about sanitation software systems and concepts. In this module, the learner will get to understand more about the sanitation ladder, sanitation-related behavior change, sanitation marketing and sanitation approaches such as CHAST, PHAST and CLTS. The other module is sanitation in different contexts. In the 5th module, you will get to learn about sanitation in different contexts such as schools and emergencies, sustainable sanitation and the linkage between sanitation, nutrition, agriculture and food security. In the next module, you learn more about hygiene and disease transmission. This module will cover hygiene promotion, disease transmission routes and the F-diagram and hygiene perspectives at both household and community levels. Also, you learn about hygiene behavior change. Under this module, some of the topics covered include principles and components of behavior change programs, risks, attitudes, norms, abilities and self-regulation, health belief model, communication for behavioral impact. And lastly, hygiene promotion management, epidemics management and global annual events. In the last module, the learner will get to develop more understanding about hand washing management, menstrual hygiene management, cholera epidemic and other epidemics management and global annual events. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.